Bryson has, through its Bryson Intercultural company, has a brief to work with the Roma community in Belfast and delivers a number of programmes to them. A health programme and education programme being two of them. We've been through that. That has given us access to the Roma community. As you know, we're based largely in Belfast, around the Holy Land. And we've been able to get from our discussions with them some of their experience on dealing not just specifically with emergency healthcare, but with healthcare generally, because what we have to say will apply, we hope, to emergency healthcare as well. And we have structured this along the lines of their experience, what the consequences of that experience have been, and we have one or two recommendations that we'd like to make. So that will be, I'll quickly get through that with you to try and keep within the time limit. Yeah. The Roma experience, if we start by just reminding ourselves that within Romania there's a culture of self-medication. Medicines are available over the counter that wouldn't be available over the counter here. So they're coming from a healthcare system which is a wee bit different. But in their experience of accessing healthcare, that includes emergency healthcare, they've encountered challenges in registering with GPs. It would appear some GPs are not that keen to register Roma as patients, and they're very often fobbed off, for want of a better word, with the idea, or with the word that their practice is full, they're not taking on any more patients. Now, we have a funding relationship with the Belfast Trust, and we know from our relationship with the Trust that is not necessarily the case, that some of the GPs that have been mentioned to them have vacancies. So there are occasions when they are not able to register with the GP of their choice. They've been given that, what we regard as a fob off. They've also encountered some attitudes from frontline staff within healthcare, whether it's in A&E or whether it's with GPs, where they feel, whether real or not, but at least they feel that they're being treated differently, that they feel that they're regarded differently by frontline staff. Of course, their situation is compounded by the fact that they have language difficulties, they have literacy difficulties as well, and even basic things like recognising in being summoned by the doctor, whether it's in A&E or whether it's in GPs, they may not be able to read the signage in the waiting room. And that can be particularly relevant in an emergency situation. And big bugbear for the Roma is that there's no Roma interpreter in Belfast. Roma language is, I understand, it's an oral language, it's not a written language. And I understand there is no Roma interpreter available. And sometimes I think some of the people within the health system try to get around this by inviting them to bring a relative with them. But again, there's an invasion of privacy there. Even close relatives, if you're coming to discuss healthcare, you may not want even close relatives with you. Consequence of that is, and I'll run through this quickly, there's a sense of them being intimidated by the healthcare system. There's a suspicion, as I said to you, of discrimination, whether that's real or they feel that they're being discriminated, that they're being treated differently. And we feel it's potentially alienating that they will only go to a GP or use the healthcare system in an emergency situation. And we feel that this, to some extent, because of their compounded again by their language difficulties, that they may be excluded from decision making about their own health as a consequence of that. And also that reliance on others to sort of broker healthcare to them, because one of the things that we do in Bryson, that we telephone GPs, we telephone hospitals, make sure appointments and so on. That reliance on others, if we want to use the fancy word, it's disempowering to an extent, because really in the ideal situation they do these things themselves. And of course, as you'll be aware, one of the consequences of this access to health is poorer health, shorter lifespans. Recommendations. that we feel there needs to be training in cultural differences at all levels of healthcare provision. And we feel there should be provision of facilities for different cultural practices. Things, for example, in the Roma community, breastfeeding in public is an entirely acceptable and common thing to do. It's not regarded yet as an acceptable or certainly not a common thing in this country. And I've witnessed that personally in my own GP practice. Appointment cards, signage, stuff like that should be reader friendly. There should be an awareness among staff that they're dealing with people who may not have good literacy skills. And we would recommend that if we could have community mentors, this is going to take a bit of time, but within maybe the Roma community, if we could develop people within that community who can be mentors for healthcare and a range of other community activities, who can build their capacity, so therefore that they will tackle that reliance on others, that they'll be able to tackle this within their own community. And Bryson, I know, are keen to do this, and we have to give credit to Belfast Trust, who we found very sympathetic to this. They have resourced us to develop a group of community mentors within the Roma community here in Belfast, with healthcare, the longer term healthcare in mind. But we feel that is something that has potentially very rewarding and potentially very useful for the Roma community generally. That's all I want to say about the Roma. Barbara will take the travellers.
No. Barbara, you go ahead, and we'll ask the questions afterwards. So.
Okay. Well, up at Manitoba we have a health project, and it delivers it deals with practical issues, but it also delivers culture awareness training to health, just to the Belfast Trust, basically, to hospitals, doctors, just health professionals. But it's a pilot scheme just started, and we need a lot more. So the traveller experience on the health services, it mightn't necessarily be emergency health care, but in general health care and public health care, yeah? 70% alone of travellers have just felt discriminated for being just a traveller, let alone going anywhere. That's in public places, including doctors and healthcare. The challenges in registering with GPs would be that some say they're full when they're not. Something similar to the Roma. Maybe not having a full, a fixed address. Say, how long have you been living there when you're registering, filling out your forms? Maybe we're just here 2 weeks or whatever. There's lots of suspicion around that. So there's frontline staff attitudes. There's lots of good staff, but if you meet the one person or few that give you a bad experience, is not actually listening and is not understanding that you've literacy issues, say you can't read or write, but they hand you this form. That's so overwhelming to get handed a form, especially in front of people also, because it's not nice sometimes to admit, I can't actually read that, or I can't sign it. Yeah. So there's a lot going on for the actual traveller person there. Also privacy again, like the Roma, if you bring a companion with you, you don't necessarily really want that. And cultural differences, like visiting relatives, say in hospital. The travellers tend to have larger families, and they could be all over, the world. It could be Australia, America, everywhere. So if there's lots, like in my own father's family, there was 18 children. So, if visiting in hospitals, sometimes staff, they get overwhelmed. So many people. It's just organising your staff better and saying, be culturally sensitive, to everyone. This is part of their culture. It's disrespectful if you don't visit also. So like give like time limit, like say 2, 3 at a bed, say for 10 minutes, or just just being more open, culturally sensitive, basically. Consequences is from the experience would be that the travellers then are feeling a bit intimidated by the healthcare. And just back to the traveller experience again, really quickly. I myself brought my sister to the hospital before, and this was A&E, and she had a sore toe. But the doctor went into A&E, got seen, and the doctor told me to shut up. Yeah, I'll never forget it. Told me to shut up. I was maybe 20 at the most, and my younger sister with me. He didn't take off her stocking to look at her sore toe, yet he was prescribing medicine. And all I said is, but why are you giving me this when you haven't actually looked at it? And he, shut up, shut up, shut up, he said, and stormed out. This was a doctor. I would never forget it, and I'll still carry that till always. That's just one. I've had millions of good experiences, but it's amazing how just one experience will actually put you off reporting something. I was told then when I explained, this doctor told me to shut up, and walked out. I was told, well, it's a lot of paperwork to do a written complaint. It wasn't made out to be very easy to do. So in a way I was put off and didn't complain. I was just happy another doctor come in and sorted out the problem. But anyway, so you can be intimidated, yeah? And alienated. So you tend, say, to go to the GP later rather than sooner, especially traveller men. Traveller men are 6 times higher suicide rate than normal, settled people, yeah? Which is a sad statistic too. All these statistics is coming out of the Traveller Health,
Yes, the All-Ireland.
the All-Ireland Health Study.
Yeah.
So there's lots of people's attitudes as well. It can cause lots of embarrassment. Ask, could you fill out forms, this and that, when they're can't read or write. Lots of suspicion and discrimination and mistrust then from doctors, simple things, even to read medication on a box of tablets or medicine. And also another problem is that in doctor surgeries and in hospitals and as well, people are often, things is computerized, and staff are assumed that everybody can read and write. It's assumed, or you can read your name on that sign there. I'd no need to actually call your name Barbara Purcell or whatever. But simple things like that, it's all about focusing into cultural differences. And it disempowers the traveller people. Sort of poorer health and shorter lifespans, like the Roma.
Absolutely.
Our recommendations are there's more need for training in cultural awareness, cultural differences at all levels of healthcare provision. Appointment cards, signage, etc. Be you want to reader friendly, basically, because some of my family that can't back illiteracy again, if a leaflet or notes, you can draw pictures. You can have a big leaflet with all the best information, but if you're not getting through to that person and they're not accessing the right for their own health care, it's affecting their life. So you want to get the message across in an adequate way. So there's a greater visibility, a need for more visibility of travellers in the healthcare sector. And I know the Belfast Trust have recruited travellers, and in Manitoba have funded programmes and now being delivered by travellers as well. So more role models, more employment, more initiatives for travellers to work in their own communities to help healthcare. It's bad statistic that they're lower in all health than the settled community. So
okay, no, that's great.
That's it.
There's just one final recommendation. I think if you just bear with us for 1 second. Do you want to look at the last one there that we discussed?
Yeah.
Okay, sure.
Just one more is that there's a potential for culturally sensitive registration marks for GP practices and A&E departments if they've completed suitable training and installed suitable systems. And you've to basically what that means, if there's like initiative, not the way there's investors in people, right? Mm-hmm. Well, if say hospitals and any healthcare services, have like an investor that they're culturally sensitive, they've got that award there in their practice, or not award, plaque, or whatever way you want to do it. But to get that, it's not just a matter of saying, oh, here we want to look good, we're a health practice here and we want to look good to tick this box that we're culturally sensitive. Just that to go through, there's a process. And say you do cultural awareness training, you can open out to students from the community, like traveller community, because that's what you want to focus on, or any community. You can work it in many ways, but it's not just that you get this plaque for doing nothing, that you there's a process in it. So, did I explain that?
No, that's absolutely
that's very clear. No, I'm quite clear. It's a kind of form of accreditation in terms of this. So I wonder if I can start, just ask a couple of quick questions, and then I'll ask my colleagues. You've given us a number of recommendations there. I'd like to focus on the emergency department, but also then the other services that also affect emergency department. So out of hours GP service, minor injury units in other hospitals, community care services, so that if you're into an emergency department and how you might be discharged, it might be that community care is needed. And I suppose my question...
Sorry, that's my phone ringing.
Oh.
In my lap, sorry. Can I go and turn it off?
Do you want to turn it off?
Oh,
yeah, it's all right.
I think it's gone there.
It's gone there.
It's gone there.
So I suppose the two issues I have is, one, whether you have any great sense of either the Roma or the travelling community are aware of those other services, or whether they tend to use emergency department. And I'm thinking in terms of Roma, for example, if you can't get access to primary care, actually emergency department, or if you can't as a traveller get access to primary care, then the emergency department might be the only place you can end up going. So that's a kind of first question about how much work is done to explain kind of other services. The second question then is that, and Barbara, you talked about being in emergency departments on a number of occasions and had a really terrible experience, and on other occasions you had very good experiences. Tell me what would make the experience, what do you think are the key things that really, you said some of them that need to be done in terms of to make, for Roma and for travellers, emergency departments a much more user-friendly place. So the first question is simply, do you think there is an awareness in both Roma and traveller community about the other services other than emergency departments?
Well, if you have it, if I could just make a response to that. And we had just, I could be discussing that very point before we came down, that there probably is and we think a strong need for, particularly in the Roma cases, where they're coming into a new country, and as you know, they're relatively recent arrivals in Northern Ireland, to know how the healthcare system works in all its many, many varied parts that you've described. So that, as well as them accessing physically accessing the healthcare, if they had a sort of a conceptual understanding of how the healthcare system works, particularly as they come from a rather different system and a rather lesser system, I would suspect, in Romania, there is a need, certainly, probably some sort of a structured programme of work, because the Roma population is only, depending on the estimates, it's relatively small, maybe 1,000, maybe as many as 1,500. So it's a doable thing in the context of Belfast, where they, through maybe a series of programmes, again, if it were delivered through people who were members of their own community, rather than people coming in the experts, the professionals coming in from outside, and I was explaining to them, here's how this system works. Here's how you access A&E and in an emergency situation, or if you need with elderly care, here's how you go about it. Here's how this, and it must be quite formidable for a person coming in to get to grips with that. It's formidable even for the rest of us who have been born and brought up here, how to access the correct and the healthcare that we need. And I imagine it would be something similar for the travellers.
Yeah, it would. But also,
I mean, we tend, I'm just thinking of our own programmes, we tend to focus on the practicalities of healthcare, diet, exercise, and many of the things that I suppose would be, that you'd recognise in health programmes generally. And perhaps there is a need to focus more on people's awareness of here's how it works.
yeah.
And that will go some way to relieve or to alleviate some of the problems, difficulties that people have encountered in going to any departments and going to GPs. If you know how the thing works.
Yeah, sure. And Barbara, the traveller community?
Yeah, sometimes it's easy to do things for people, like, oh, here, I'll sort this out. But it's actually better if you let the person know how to do it for themselves.
Mm-hmm. Yeah.
So that's, I think, sometimes as a worker, you can get you get caught up in that. It's like easier to sort something out, like yourself, because you know how. So it's just about passing the information on in a proper way. What you know, what you've got trained to do, you train your community, and there needs to be more of that and less of. It sounds horrible, but less like doing things for people. Yeah. You want to let them know, so they can tell their family and sort out their own things in time.
Okay, and then my second question was, what would make it a better experience? You've said some of the things, start with you, Barbara, based on perhaps some of your own experience too, but also your experience of working, with travelling community. What would make it better? We've talked about signage, you've talked about being more culturally aware.
Yeah.
Are there any other things that you think would make a difference in terms of how emergency department care could be delivered for travelling community?
I think maybe about people with addresses and where you've lived. Say if I was travelling around, I'm not though, I live in the one place, but if I was a traveller who travelled around and didn't have a steady address, right? Or if I used an address but didn't actually live there, I was travelling around but had like a base, an address, which loads of people do that, yeah? So I'm not necessarily getting my appointment if I'm not there. So would it be simple, like say a designated worker that worked with different communities within the practice or the hospital, wherever, that they, just check up on things, because it's all paperwork. If you get knocked off, say for an eye test, it's just something so simple. If you don't ring up and make your appointment, you get knocked off. So it's all paperwork. You have to go back to your GP, get re-thinged again. It's the word, can't
re-referred.
Yeah, re-referred. It all seems like a waste of time. Whereas a simple thing, if it was a phone call or some designated worker just to follow up on actual things in these disadvantaged communities, I think it would save a lot of time and paperwork and stress maybe for the people who genuinely have missed the appointment. It's not suspicion that, they're not concerned or this or that. There's other issues why they mightn't have rang for this appointment. Like anyone, not just travellers. But
would it be helpful then if you were in the emergency department to, before you leave, for example, in certain circumstances, to be told if there's a follow-up appointment when it is, rather than we'll either write out to you or telephone you or
it could be just
later.
Simple things, like it's not big rocket science. They're just simple things to communicate better, or not even better, just adapt, communicate in different ways. There doesn't have to just be one solid procedure for.
Okay, great. And Eamon, anything in terms of Roma?
Well, I think the language is the big thing. and going into access healthcare, and you're not being able to speak, and there's no one there can speak for you. I mean, some of the Roma community would speak Romanian, but by no means all of them. And I know that, or at least I understand that there is an interpreter service. There's a telephone service available, but not for Roma. So I think that would be the big thing, and I think that would help allay some of the sort of the fears and suspicions and the intimidation that people will feel if they're able to have someone to speak to them in their own language. And I mean, some of the things that the Roma people would feel towards the healthcare system may not be founded in fact. The attitudes from the health professionals is fine. It's just that it's very easy for misunderstandings and very easy for people to get the wrong end of things if they're not in command of the language.
Sure. Can I, and if I pass you over, Marion, is what you're saying that, for example, the access to what I assume is language line in
that's what I understand. I'm
departments
not familiar with myself.
don't actually have, the language line service then doesn't actually have Roma as one of the
That's
languages.
what I understand. That's what I'm hearing. Yeah.
Okay, thank you. Marion.
I just wanted to pick up on a couple of points that you've made. You talked about, some of the health promotion information, and I'm wondering, is there any work that the Public Health Agency does with either the Irish travellers or the Roma population in terms of health education, health promotion, so that it limits the amount of calls that they would need to go to emergency medical facilities if there's better health?
Well, I'm aware that the funding that we in Manitoba would receive from Belfast Trust they receive the funding from the Public Health Agency. So to that extent, and the same would apply to the health programs that we deliver with the Roma community. So to that extent, the PHA are involved and they have made resources available specifically for that. In terms of health promotion, in terms of your question about whether that would alleviate, I don't know is my honest answer. I'm not aware of it. There's certainly a need for health promotion in both these communities, and there have been studies, of course, that have examined that and the various factors, diet, health, and all the rest of it that contribute to their shorter lifespan and so on. But I'm not aware of anything else that's being done for these communities. Certainly in Belfast, in terms of the travellers, we would be aware of it because we're the only traveller support organisation in Belfast. There are one or two other organisations that would deal with or deliver services to the Roma community, but I myself I'm not aware of any other PHA health promotion activity. But it would certainly be a strong recommendation. And as I said in my delivery earlier, in a way it's a two-way thing. That if the Roma community, if they are empowered, if you want to use that fancy word, to know how the system works, I think that would go some way to resolving a lot of issues as well. If they just through knowing how to access healthcare.
I want to pick up on the bit about literacy problems. And I mean, your phone has gone, so everybody has a mobile phone these days. Is there a way to deal with hospital appointments and even reminders to people to take their medication, which could be done through telephone, or I'm not sure that text messaging would work if people don't have literacy, but some sort of technological approach to reminding people?
Well, it's difficult to say. It seems to be as hard to beat a simple phone call. Certainly in the case of the travellers. In the case of the Roma, I mean, I'm minded about your story about your uncle and the shopping list. We go to it's not a written list. He has drawings of the stuff that he wants to buy.
Yeah, it's a proper shopping list. But if you actually look at it, Like, yeah, I'm his niece. I looked at. Here's a shopping list. Yeah, he said, look, I can draw like my own picture of a loaf of bread, picture of a jug of milk. No, pictures. But that's his shopping list. That's straightforward to him. It's not a joke or like he's serious.
It's just difficult people how to tackle that in a technological way. Again, I think in the longer term, the answer will lie maybe in having people in the community who can sort of go to people that you can go and or who can remind if there's especially with older, I imagine with older Roma people who are less likely to develop the skills, if there are people that they can go to who can remind them, give them the information, that might be through whatever technological means. The younger people coming up, if you give them a generation, will probably be able to handle this. But as an interim measure, there's no obvious, easy technological means that I can think of other than a phone call to somebody who speaks that language. You know, it's a difficult one to get around. There's no question about that.
I have only one final question. It's not really about the two projects that you're talking about. It's just you've talked about the well-known care services that Bryson Charitable Trust provide. Are there any other projects that you have which relate to either the community care or health care of other groups in the community?
Well, Bryson Healthcare would provide healthcare and family support to the wider community as well, not just the Roma. And
so there's a much bigger package.
Oh, it is a much, yes, absolutely. And I know that Bryson would be keen to develop that into, particularly in the Roma community. That I imagine is already available. Am I right in thinking within the traveller community that the Bryson, the Bryson family care, family support, would that? Oh, in fact, I know for a fact it does because I know of exact examples where it has worked. But they would be keen to develop that and are keen to develop it for the Roma community because it too is an important part of healthcare and is probably not being catered for, as I understand it, in the Roma community at the minute. Apart outside the normal sort of orthodox healthcare system.
Thank you very much. Thank you.
Paul.
Good afternoon. I can be very brief, but thank you both very much indeed for providing us with evidence. I found it really instructive and really helpful. And I think I noticed from the papers the Traveller Health and Wellbeing Project recently picked up the Promoting Health Equity Award, of which Bryson are part in association with the Belfast Trust. And that was presented by the World Health Organization. So that's brilliant, and congratulations for all those responsible. I've just got one question, and you'll excuse me if it betrays my ignorance, but I'm here to be educated, okay? How easily available, is disaggregated data made available routinely so that it's possible to comprehend the traveller status and Roma status, and having got that information, then it's possible to devise appropriate measures. So my question is there routine collection of data concerning health that is disaggregated in relation to traveller status and Roma status? Am I clear? Is my question clear?
I think
it's things like would you be able to know how many times somebody from the travelling community visited emergency department, for example? Would that kind of data be available? That's the kind of stuff you're thinking of, Paul?
Yes.
Down south, I think that is the case.
Down south.
Because I have seen statistics, fairly detailed statistics around not just mortality rates, but say rates of attendance at hospitals and that sort of information. It strikes me I may have seen something like that in Britain for the traveller community in Britain. I'm not aware that I've seen it here in Northern Ireland. As for the Roma community, I would have thought not. Not pointing fingers, but the Roma community, they're relatively recent. I'm sure the systems for collecting that haven't been. I'd be surprised if they were in place. Let's put it that way. But I haven't seen anything like that in Northern Ireland for travellers. If you were to ask me, how often do travellers visit the GPs? How often? What range? I'd be struggling. I can't think of a particular study or a particular report that would contain that.
The only thing I can think of is looking to All Ireland Traveller Health Study. That covers Northern Ireland and like the south of Ireland, right? And that gives you information on, say, like a simple thing where it's calculated up right. Before, I think they said in Northern Ireland, there was like, say, I think was it 1,300 travellers or something, for talk's sake, yeah? But the actual figures, there's over 4,000 families, right? So in Belfast alone, I think there's something like, can you remember what, in Belfast alone, it's maybe, say, 1,400.
I think the figure they use is somewhere around about 1,000.
Yeah.
But nobody knows really. Nobody can put a precise figure.
Yeah, precise, because like what time of year it was people who lived there maybe gone away working or whatever, yeah? Like nomadic lifestyle, yeah? But simple things like that shows you like, so like before that study came out, we were maybe focusing on thinking there was 1,300 or 1,400 when actual fact was near triple that.
Well,
So-
sorry, go ahead.
That just there's all different stuff. The All Ireland Health Study is that massive to go through.
Comprehensive.
Yeah, but you can get like a summary of it. So just for your own information, even if you want to look up children's health or adult, just anything, look in that. I don't actually have it with me, or I could have read you out and stuff.
But
By way of sample, I just a statistic I took with me. I took it from the All Ireland, and they're able to say the mortality rates for traveller men against the male population generally, and the same for women, are going different age bands, right up to 85 plus and so on. So there's that level of detail is available in the All Ireland in the health study. But it includes Northern Ireland, but if you forgive me for saying so, it is, in my view anyway, it's weighted very much to the experience in the south of Ireland. But in terms of statistics published here by the health bodies here, the PH, I'm not aware of it myself. Now I have to say it doesn't mean it doesn't exist, but I'm certainly not aware of it, nor has anybody in Munjatubber, I haven't seen anybody refer to or being able to avail of that sort of information. So there's a possibility, if there may be a requirement, there may be a need maybe to study that, to get precise information. And I imagine it would be a doable thing again. People registered with the GP practices.
It should be like ongoing little
be.
studies going on.
It seems like a doable thing.
The All Ireland study, if I understand correctly, that's a really important study. It's a one-off study.
Why it was so accurate, right? Before settled people, right? Done all the statistics and done all the lobbying and everything. So the All Ireland Health Study was drawn up for travellers themselves to go out into their community, and that way it's accurate. They know where the other travellers are.
But what I mean is it's a snapshot at one point in time, and it's really important.
Yeah.
And what I'm trying to understand, and I think you've answered it, trying to understand is whether or not, routinely over time there are these studies which would enable us to track whether or not things are getting better or worse or whatever.
Yeah.
So finally, and if I could push you a little bit on this, I think you've answered it, but just to make sure I've understood correctly. Sometimes some groups are really somewhat apprehensive about disaggregated data being collected. They fear that it'll be misused. They fear it'll be abused. And the intention for collecting the disaggregated data might be really good because you want to find out the problem for the community and then deal with it, right? But there's a fear in some communities, I'm not saying yours, that's what my question is about, but I know that in some communities, in some countries, there's a worry that disaggregated data will be misused against them. So just off the cuff and just very briefly, do you have a worry about the use of, or the abuse of disaggregated data if it were made available?
Well, I personally would have, I should be aware, the proposal to aggregate GP data, not just for travellers or Roma, but for the population generally. I personally would have a concern about that. But I imagine, and I say, I don't know, it's not something we've spoken to the Roma about,
right.
But I imagine, based on what I know and their cultural outlook and how they function as a community,
yeah.
and the closeness, the networks, and how they are very much a self-contained, they live and socialise, and I imagine they would regard that, I'm pretty confident that they would regard that with a fair degree of suspicion. I'd be interested to see just how much cooperation anybody would get in putting that sort of data together.
The disaggregated data?
Yes.
Okay,
yeah.
Thank you. Sorry, do you wish to respond?
Yeah,
No, I mean, I imagine, Barbara, that within the parallels between the Roma and the traveller communities are very striking, and they're very, very close parallels.
They are, but yet they can be in other ways. They're like different also.
Different cultural practices. That's true.
Yeah,
That's true.
yeah.
So, Barbara, do you think there would be some resistance to
Right,
disaggregation?
can I
of data?
ask a silly question? What is disaggregated?
Yeah.
Because that.
Yeah.
I'm sorry, I should have explained it better. What I mean is that you can know how many people are coming into an emergency department, and you can have one figure about there are so many thousand people coming in 1 month. And that one figure alone, that's not disaggregated. But if you disaggregate that data and you find out how many women are going in and how many men are going in,
So
or
break it down.
Or how many children are going in, or how many Roma are going in, or how many travellers are going in, then you can begin to see, that begins to tell you stuff, important things. And then if you see there's a problem, if the disaggregated data shows there's a problem, then you can devise interventions, policies to try and redress the problem. Do you see what I mean? But without the disaggregated data, it's difficult to devise suitable policies. Am I clear, Barbara?
Right. So would that not just be a matter of like ticking a box when you go in?
Yes.
Like would they probably hospitals and all would have that data there, sitting there anyway?
Well, some countries do it routinely. Other countries refuse to do it because they think there's a risk of that data being abused.
Yeah.
So that was my...
It depends how, I think if you were to do something, you'd need to be very clear on what exactly you're doing it.
You need some safeguards.
If is there any consequences? You need to explain it very good.
Right. Especially in a small place like Northern Ireland, where
it could to go over the line of privacy.
Yeah. Okay. Thank you.
Okay. Thank you. We've said this to everyone who has given evidence that if you want to give us any additional material about either of the two projects you're running, that would be very helpful to us. And is there anything you'd like to say just in concluding remarks, either that you think you haven't covered or that we haven't covered with you?
Feel free to contact Bryson and Money October anytime if you want any more information.
If it's in any way useful to you, we could email or just make available to you our notes if you feel that would that would facilitate your note taking or whatever. But we're quite happy to do that.
Yeah, that would be very helpful, and with your recommendations that would be very useful. And just to say thank you very much, because these are two groups that we obviously haven't heard from firsthand, so it's very useful to hear about the projects, and good luck with your work.
Thank you.
Thank you very much.
Thank you very much.
Thank you.